New data from the CDC shows opioid overdose deaths dropped by 27% last year. That's the largest one-year decline on record. But a growing number of health experts worry all that progress now could be lost. NBC News correspondent, co-host of News Now Daily, Morgan Radford, joins us with more on that warning. You've been covering this crisis, Morgan, for a long time. So what do health officials say? What are they worried about right now?
Yeah, the simple reason, funding cuts. The Trump administration has proposed more than $6 billion in funding cuts to the CDC and other agencies which deal directly with the opioid crisis. And it's not just researchers and doctors who are sounding the alarm. We went to a small town called Huntington, West Virginia, where we have been covering the opioid crisis for almost a decade now to see what they had to say.
That was me when I was sober, actually.
Rebecca Queen says she's been addicted to opioids for 17 years.
I probably use every 3 to 5 hours.
But 4 months ago,
Here's the needles.
that addiction almost cost her her life.
They called it death dope, and this is how I'm saying it. And the addiction is I sought it out.
You sought out the death dope.
Death dope.
Dope that would be so powerful it would bring you near death.
Correct. I had died. 2 Narcans brought me back.
Now, health officials here say that Narcan, a drug also known as naloxone, that works in minutes to reverse overdoses, is in jeopardy.
What if I told you that there are proposed government spending cuts that make it harder for you to get Narcan?
I think they're trying to kill us off. We're a nuisance. We're like raccoons and pigeons.
The Trump administration is looking to cut $56 million in annual grants that fund naloxone distribution. Here in Huntington, West Virginia, which attorneys for the city have called ground zero for the opioid crisis,
you can't even walk your kids down the road without probably stepping on a needle.
Local health officials are taking drastic action.
So this is one of the closets that we keep the Narcan.
So you are stocking up on Narcan right now
We are gathering as much as we can.
in case those funding cuts come.
Yes.
Connie Pretty leads the Huntington Quick Response Team,
Is this the QRT headquarters?
Yes, it is.
which deploys to overdose calls with specialists trained to save lives and to help guide people out of addiction.
When is the last time someone has used Narcan to save you?
When I overdosed.
About a year ago?
Yep.
Pretty met with First Lady Melania Trump to discuss the opioid crisis in 2019, 3 years after our team visited Huntington when the city was overwhelmed by overdoses.
Now, what is the bleach for?
To clean dirty needles.
We went back in 2020 during a pandemic spike,
This is a track mark.
and now the city has finally managed to get overdose calls down by more than 70% from their peak.
And there's a lot of people here that...
A hard-fought battle that Pretty fears they may have to fight again. The Trump administration is looking to cut more than $6 billion to the CDC and other federal agencies that directly address the opioid crisis.
We're a small community. The funding is just so important, I can't even tell you.
I wonder how you wage a war on drugs without paying for it.
You can't. You've just got to decide, are lives important enough to save? Is the money more important than the good that you will do?
Do you think voters understand that decision?
I don't think so. Am I trying to stand here and say there's no government waste? No. But lives, saving lives is not government waste.
Cuts that would affect people like Silly McElfresh, who says Pretty's team saved her life after years of addiction.
I was on fentanyl for many years, died so many times. So many times sorry.
Take your time.
But I tried to go to treatment. Most people did not care about me at that point.
Did the quick response team save you?
Yes, multiple.
With Narcan?
Yes.
Now 3 years sober, she uses her experience as a certified peer counselor to help others escape addiction once and for all.
What happens if funding goes away?
People start dying again. People will start dying again.
NBC News reached out to the White House for comment, but officials did not respond by deadline. The president did sign an executive order in February aimed at disrupting the synthetic opioid supply chain from China. Willie.
Saving lives is not government waste. That is a powerful line there we heard in the piece. So let's talk about fentanyl. Donald Trump, the president, has talked about it a lot, now doing something. What is it exactly?
He's always talking about the supply side. He's always talking about stopping the influx of fentanyl from abroad. But when you talk to people who are doing the work where the boots meet the ground every single day, they said, look, the supply chain isn't the total issue. It may not even be the bulk of the issue, because people like Connie said, we got the numbers down. In the last 5 years, we've seen this influx of fentanyl. We still managed to get the numbers down, but we did that by focusing on demand. And the only way you can focus on demand is with those with those government programs that are funded by federal, state dollars.
Yeah, I think what you hear there is a cry for help. We need this funding, and we need it badly. Please don't stop the progress that we've started to make. Fascinating look at this. NBC News correspondent, co-host of News Now Daily, Morgan Radford. Morgan, thanks. Great to see you.